I was not just a doctor. I was in education. I was training the physicians of next generation. And yet I was addicted to these. Yes. So, April 2014. I was in my 30s. I already was suffering from regular knee pain. I couldn't stand more than a minute or few minutes and my knee would start hurting. I had a severe back pain, chronic, not acute, going on for a long time. I was getting physical therapy on regular basis. And yet I was addicted to these. I was eating 6 of them every day. Yes, even though I knew they are not good for me. But here I am having cured my addiction. How did I do that? Watch the video to find out. So this is Dr. Binay Kumar, a practicing physician in California state of USA, a triple board certified MD. So friends, before we jump deep into this video, I have a request from you. I see majority of you watch me on regular basis and yet you're not subscribed. If you subscribe me, that will be a big motivation for me. So let's get started in this video. If you see the nutritional label of this chocolate, the 3 balls have about 13 grams of saturated fat. I was eating 6 of them. So that is about 26 grams of saturated fat. Well, how much saturated fat is okay? Let me tell you. Saturated fat is the most inflammatory natural food component known to humankind. You get that? Okay. So, according to me, you should aim as little as possible. But if you go by American Heart Association, they recommend less than 6% of your calories should come from saturated fat. So, I am on a smaller side, but an average Western adult need about 2000 calories. So 6% of that will be average Western adult will need about 2000 calories a day. So no more than 120 calories should come from saturated fat. And that would be about 13 grams of saturated fat. And I was eating double of that. Yet I already was suffering from poor health. So something had to change. And additional saturated fat coming from my eggs, my cheese, my chicken, and other food was separate. So you can imagine how much saturated fat, the most inflammatory natural food compound, I was eating on regular basis. So clearly I had to stop. But how do I do that? The first step is to see it's not good for me. Good for me in what sense? Long term, my long term health goals. If I eat these chocolates, I may not feel so much today, even though you will feel same day. Your joints will tell you same day that you hurt much more. But I had to see my current action and my long term health goals. So, my long term health goal was that I want to live long in a healthy body so I can do all the things I enjoy. I can go on long hikes with my family and friends. I can play tennis with my friends. I can play ping pong. And I just continue to do what I enjoy doing. I wanted more of life. I was not ready to die early living in a sick body. So that's the first step, seeing the discrepancy between my current action and my long-term health goals. But just seeing that is not going to be enough, because if you just stay in your mind thinking and being cognizant about it, the thoughts have a very fuzzy quality. They are like dreams. They are like mist and steam. They just dissolves. You can't benefit too much from them. So the action plan had to come. How I make an action plan which stops me right on my track when I'm heading towards these, and just trying to unwrap it and just eat them away, and one after another, 6 of them every single day. So the action plan could have been, okay, I'm just gonna eat 5 or 4 and 1. That doesn't go well with me, because that keeps the taste awake in my mind. I keep craving, I keep remembering next day again. So that didn't work for me. So what did I do? I said, here you go. I am going to eat them, no problem. But first I have to do either 30 push-ups, or I have to do 5 minutes of meditation. Once I've done them, I can go ahead and eat those 6 Lindor chocolates. Now, what happened? Since that day, it has been 10 years. Not a single Lindor chocolates I have eaten. I am impressed. I don't know if you are impressed. I am impressed. So, why it happened like that? I kept on going for months and months, and how suddenly I was able to do that. Because when I'm eating these chocolates, my primal part of brain is active. My deeper part, which is very limbic and very old, come from like a crocodile, like very millions and millions of years old. So that part of brain is very emotion based and feeling based, and very now based. So I was acting on that. But when I'm doing exercise, when I'm doing meditation, I started empowering the newer part of brain, the neocortex, the prefrontal cortex. And those part of brain you use when you're using a long-term plan, when you are making a plan which is good for your long term, even though it hurts you, even though exercise hurts in the short term, but it's good for you. So I was empowering my that part of brain. And this is how I did it. I just empowered my more evolved part of brain, and the more primal brain went to sleep. So this is how I did it. So my friend, this was just one example of how I treated my addiction. I am a practicing addiction specialist in California, USA. And there are many tools I use to treat people's addiction, but this was one which I used in my case. Until next time, namaste and stay well. And other interesting topics related to staying healthy and slowing down the aging process. Stay blessed. Namaste. Adios. Zaizan. Khuda Hafiz. Alvida.